Welcome. My name is Alexandra, and I am going to be the moderator for today's webinar. We are going to give everyone until about 3 minutes past the hour to join, and then we will get started. Hello again. For those of you who have just joined, my name is Alexandra, and I am going to be your moderator for today's webinar. We are excited to present to you our webinar, Best Practices Part 1 for the Medical Office. We will discuss some best practices for running a medical practice, including some tips and tricks to use with staffing, patients, security, and more. And you will learn some ways to market your business that will help you grow and succeed. Before we get started, there are a few housekeeping items to go over. Questions you have for us are addressed via the chat message using the Q&A button at the bottom of your screen. The questions you submit throughout the presentation will be addressed at the end of the presentation. Questions we have for you are addressed using polls. A poll will be conducted before and after the presentation. We encourage you to participate so that we can focus on areas of interest. Before introducing you to Caroline Balestra, I am going to go ahead and launch the first set of poll questions. Thank you for participating. Caroline Balestra will be the presenter today. Caroline has 8 years of experience as a practice administrator and 13 additional years focused on revenue cycle management and analysis. She currently works as a business process analyst at HealthPrime, where she coaches team members and clients on best practices, coding, and practice optimization. Without further ado, I am going to turn it over to Caroline for the presentation. Sorry, Caroline, you're muted.
Oh, thanks. Thank you, Alexandra. Welcome, everybody. Today, we start a three-part series called Best Practices. Part one, we will talk about best practices for the medical practice overall. In a couple weeks, during part two, we'll talk about best practices for the front desk. And finally, part three, in a few weeks or so, we'll review best practices for the back office. Let's dive right into the first part of our best practice series. So again, today we're talking through how to create best practices for the entire medical office, starting with hiring, training, and supporting staff, creating loyal patients, reducing Hipaa risks, marketing your practice effectively, to asking for help when you need it. Let's go ahead and get started. When hiring new employees for the front desk or any position in your practice, it's important to thoroughly vet them. Of course, you already know that the review of all incoming applications or resumes for experience in the task that they would be potentially hired for is important. But if they have no experience, you would need to evaluate them more so during the interview process to determine if they have the ability to learn quickly, follow instruction, pay close attention to detail, etc. Putting a standardized plan in place for the interview process, questions and answers, for example, can be key to an effective and simplified hiring process. Ensure your interview assessment process contains questions that will help you identify if they would contribute positively or negatively to the team. Using the same template of questions and answers for each candidate can help you to quickly identify key skills for any potential employee. When it comes to how well they work with others, this can sometimes be determined with answers to specific questions like, describe a time when you disagreed with a customer, supervisor, or a coworker. What did you do to resolve the conflict? And what was the outcome? But I find many times you will get more candid feedback from prior employers when it comes to this particular topic. Finding great people can be a challenge, but best practices must continue when it comes to having excellent staff. Let's talk about training and supporting those staff to retain them once you've hired them. In order to have excellent staff, we need to properly train them for the role they will play within the practice. It's important to remember that everyone learns differently and at different paces, and that's okay. Some will learn more from hands-on activities and actual doing, where others learn from reading and comprehension, and still others can also learn from interactive video or shadowing techniques. Many times you'll find that a combination of two or more of these methods are best. Cross-training all staff members where applicable is really important, as this allows for coverage where needed, when needed. Unfortunately, it's not enough to simply say, here's the login to the account. Good luck, and let me know if you have any questions. Employees need to be provided a framework of expectations, accountability, and check-ins to make individualized learning work. Okay, so let's say you found excellent team members and hired them. Then you train them for their position and cross-functional positions as needed. But in the most successful practices, continued support for those staff members is what retains great employees. It can be a challenge to retain the staff you've worked so hard to first find and train, but now it comes the most hard and important part. Providing consistent support in their job by giving them the tools and resources they need to do a fantastic job, while also offering them professional development for continuous career growth, can be challenging to say the least. If not planned out and done effectively, this could ultimately cost you in the long run with turnover rates. When you have to start over with hiring and training and all the costs associated with starting the process all over again, things can get expensive very quickly. Professional growth and development is important in retaining staff. The ability to learn from others and continue to enhance knowledge in an employee's respective role is important. Additionally, providing training options, whether it's something like, for example, let's say your practice administrator comes to you requesting to take an Excel course to help improve his or her spreadsheet formulas and skills. Of course, each request should be evaluated to determine relevance, relative value to the business, and costs associated. But also, would this learning benefit the practice? Ultimately, in this example, this course would not only help the employee's growth, but would also help improve upon your practice's Excel reporting moving forward. So depending on costs associated, this requested course could be beneficial for both parties. Most importantly is the communication with your staff. Many managers and administrators fail to see how the way they communicate about career development has a big impact on how employees perceive growth opportunities. For example, I've heard employees say, when it comes to career development, many managers think only in terms of the company's official policies regarding career advancement. But this is a mistake. Careers are developed more organically. Career development is far more than just checking off the boxes in a performance development plan. Managers have a lot more influence than they realize when it comes to helping employees grow. When employees ask what they need to do to progress in their career, it's not enough to just give them praise, such as, "You're doing a great job. Keep doing what you're doing." That lacks the specificity needed to help them advance their skills. Instead, say, "Here are 3 strengths that will serve you well in your next role. The area that I think you need to focus on developing is X, Y, or Z. So let's talk about how to give you the opportunities to grow that skill set." The good news about career development gaps is that they're easily closed. Lastly, I think it's really important in a medical practice to provide an open door concept regardless of titles and positions within the company. This sets a precedence for your office culture and allows interaction on multiple levels. An open door policy means every manager's door is open to every employee. The purpose is to encourage open communication, feedback, and discussion about any matter of importance to an employee. Employees can take their workplace concerns, questions, or suggestions outside their own chain of command without worrying. Adoption of this policy develops employee trust and makes sure important information and feedback reaches managers who can use it to make changes and improvements. Okay, I'd like to discuss patient loyalty and creating raving fans out of your patients. The traditional thinking about the doctor-patient relationship, where the physician is largely in control, is giving way to the customer-provider relationship for good reason. The move toward consumer-directed healthcare means that providers need to focus on providing an experience that keeps patients loyal and proves value. Ensure you and all providers develop a clear vision for patient care. After all, great customer service is always really important. An excellent best practice to adopt and build patient loyalty consists of frequently requesting patient feedback. Ask patients about their experiences, expectations, and understand what's most important to them. The feedback they provide will help you to familiarize yourself with the factors driving or hindering patient loyalty. If a patient expresses concern or mentions a bad experience, take the necessary steps to resolve that issue right away. Don't let it linger, or the patient may have a bad taste in their mouth when they receive that next appointment reminder. Some additional things you can do to earn loyalty with patients is to simplify things for them. Things such as check-in, New Year paperwork updates, new patient forms, expectations from your front desk staff, etc. These can be simplified to ensure your patient experience is uncomplicated and enjoyable. Let's face it, no one wants to come into an appointment and have to fill out 20 sheets of paperwork. Also, coordination of care is an aspect of service that can be extremely helpful for patients. Maybe sending of records, referrals, or calling a referred to provider for the patient to help get them on a busy schedule. These things are simple and help to create raving fans out of your patients. Minor simplifications can make things easier for your staff as well. It's basically a win-win. It's important to practice follow-up and follow-through. This is a bigger complaint I hear a lot of the time from everyone, not just patients. Lastly, a simple thank you is always appreciated no matter who you are. You'd be surprised at how far a thank you will go these days. Be nice, build a relationship, and say thank you for their patronage. Consider following up with an automated thank you email after appointments to reiterate your gratitude. Let patients know how you appreciate them and their business, no matter if they're new or established patients. With any healthcare office, it's important to establish a risk-aware culture. Medical practices and their business associates must comply with the Hipaa privacy, security, and breach notification rules and implement reasonable safeguards to prevent violations. Even with controls in place, violations and data breaches can still occur. Most breaches that occur are unintentional, but still pose a serious issue and consequence. The goal is to try to limit or eliminate these occurrences completely if at all possible. In order to do this effectively, it's important to ensure employees receive full training on Hipaa and know the allowable uses and disclosure of PHI and ePHI at all times. Refresher training should be provided regularly to ensure Hipaa rules are not forgotten. Here are some common ways Hipaa rules are violated by staff. Safeguards to prevent these violations will help you save time, money, and frustration in the long run. Staff in any healthcare setting should never disclose or share login credentials. Every employee is provided with a unique login through which they will be granted access to sensitive information. It's therefore essential that those login details remain private. Never leave portable devices or documents unattended. A lost or stolen device containing ePHI is reportable under Hipaa rules if the device is not encrypted. Portable devices must never be left unattended and when in use. The same applies to paper records. Even when busy, healthcare employees must never leave documents containing PHI in areas where they can be viewed by unauthorized individuals, picked up by other healthcare workers, or seen by other patients. Don't text or email patient information. Text and email messages are a quick and easy way to communicate, but unfortunately, none of these have the necessary controls to prevent accidentally disclosure of ePHI to unauthorized individuals. If you must send ePHI, only do so through approved channels such as secure healthcare designated text platforms or encrypted emails. Don't dispose of PHI with the regular trash. Any document containing PHI of a patient must be kept secure at all times and disposed of securely when no longer required. Hipaa requires all PHI to be rendered unreadable, indecipherable, and unable to be reconstructed when it's no longer needed. Your practice should have strict rules covering the disposal of PHI, which prohibits the disposal of documents with the regular trash. You must be extremely careful to ensure that any paper copies of PHI are disposed of securely. Yes, there's more you can do. Let's continue reviewing how these violations can be prevented further in the office. Next, never access patient records out of curiosity. Accessing health records by employees without a valid, legitimate reason for doing so is a serious violation of HIPAA rules and patient privacy. Healthcare employees are only permitted to view patient records if they are required to do so for treatment, payment, or other specific healthcare operations. If medical records are accessed without proper authorization, it can result in termination and potentially criminal penalties against the individual concerned. The employer can also face heavy fines and considerable reputation damage if this were to occur. Don't take medical records with you when you change jobs. So when an employee leaves the practice, they can be tempted to take PHI to recruit patients or sell medical services or equipment. But taking any medical record, even if there is a long-standing relationship with the patient, is data theft and could also result in criminal charges against the individuals involved. Don't access your own medical records using your login credentials. HIPAA rules allow patients to obtain copies of their health records upon request. But as an employee, you do not have the right to access your own medical records using your own login credentials. You should always follow the same process as patients to submit a request for your records. Lastly, report potential HIPAA violations. If you believe a colleague has violated HIPAA rules, it's important to take actions to prevent similar incidents in the future. Reporting potential violations to your compliance officer is necessary to protect patients, their data, and ultimately the practice. The compliance officer is responsible for reporting any violation of HIPAA guidelines appropriately. Okay, so hopefully if you're taking all of these precautions that I covered, you can feel confident and comfortable that your patient's protected healthcare information is just that, protected. Let's talk next about marketing and growing your practice. When marketing your practice, it's helpful to begin by establishing what your goals are and how they'll benefit your patients. When developing your marketing strategy, start by establishing your skills, your target audience, and how your skills will benefit that audience. As a medical professional, you can help inform your patients as well as develop your reputation as an excellent healthcare provider. Marketing might feel somewhat new to medical providers and practices, but there are some excellent marketing tools out there just for you. Some of the things that you can do to increase your market presence include creating a responsive website where information is readily available for anyone looking for a provider of your type, specialty, and geographical location. On your website, you can, among other tools, provide a guide to patients on things like frequently asked questions or difficulties. Warm approaches and informative content encourages patients to explore the site and helps to develop trust in the area of expertise that you offer. Call to action buttons on any website could allow your patients to maybe set an appointment and take other actions such as download patient paperwork or contact the office. As even an individual provider, it's possible to establish yourself as an expert in your field online. Statistics show that 84% of patients watch online videos or seek out information digitally in order to understand complex medical symptoms or procedures. Sharing your knowledge via a professional blog to connect digitally with online users can help draw patients in with stories, needs, and experiences. These can enable the sharing of information online and the ability for medical practitioners to build community relationships and make additional contributions to healthcare. Another tip for your site would be to include the sharing of your patient's stories. These stories can help patients feel less anxious about approaching your medical practice. Medical procedures and visits can often leave patients and caregivers feeling uncertain and anxious. People want to better understand the process they will go through, feelings involved, and how complicated the procedure might be. Providing stories of those who have been through the same situation or procedure adds a human touch and approaches medicine from an empathetic perspective, through the eyes of the patient, so to speak, and helps to reduce fears. You or your staff could put together a plan to assist your patients in creating clear, simple, and easy to read stories that will keep viewers engaged. As we all know, with COVID-19, things are a bit different, but we can still provide community forums and workshops virtually. These could range from nutritional health and healthy lifestyle to specific health-related diseases such as diabetes. Using a virtual community workshop, you could encourage screening tests and disease management techniques. Creating handouts to share can also be extremely helpful for patients and will keep them engaged. A monthly newsletter is another easy way to begin conversations with patients, as well as keep them updated on frequently asked questions, changes in your office, and can also allow the sharing of great information as well. For example, the management of stress is a huge topic that everyone is looking for help with. Sharing your perspective on how to effectively manage stress helps with engagement. You can also share announcements and remind patients to schedule their wellness visits. These things can be extremely helpful when putting together a successful marketing plan for your practice. My last topic today is about asking for help before it's too late. It's important to know when it's time to ask for that help. Turning to a professional, experienced revenue cycle management service such as Health Prime can offer many benefits. Let's review. Outsourcing your billing allows for you to let someone with extensive billing knowledge and experience take on the daily billing tasks, which can help free up your medical office staff for more patient-centered tasks. Health Prime staff can work with all practice management softwares or EHR systems. We have many billing team members and support staff that have experience in all types of medical software applications. We can also help to improve your documentation and coding accuracy prior to claim submission. This is important for getting paid quickly and correctly. With these processes being handled by certified coders and billers, your claims data and AR are in qualified hands. Accurate, timely submissions mean fewer denials caused by staff who can often be distracted by other office and patient-related duties. We provide faster claim follow-up to ensure we are well within resubmission deadlines on claims that may have been rejected or denied. This means that you will have a better chance of capturing reimbursement for those specific claims. We can also provide services that assist with front office tasks to allow your staff to improve on patient and customer services. Allow Health Prime to verify eligibility, obtain authorization, or make appointment reminder calls for you. This also helps to reduce rejected and denied claims, which ultimately results in higher reimbursement rates. This basically improves the bottom line of your practice's revenue cycle. Health Prime's Datalytics tool is an analytical practice optimization tool that we offer, and this can change the way you look at your practice's overall health. This Datalytics tool can provide insight into daily, weekly, and monthly focal points to allow streamlining and improvement of office and billing processes to ensure your office claims and related financial reporting is in order. Health Prime also offers some additional helpful solutions, which are certified coders, coding reviews, vScribe transcription services, patient notification services, in addition to the aforementioned Prime virtual front office services like eligibility and benefit verifications, outbound appointment confirmation calls, authorizations, et cetera, et cetera. Health Prime offers these services to help free you and your staff up to provide a more patient-focused level of customer service for your patients. Feel free to reach out to your operations consultant if you're already using one or more Health Prime services, or if new to Health Prime, you can reach out for more information in a few ways. You can request a meeting on our website at hpiinc.com or even via email at businessdevelopment@hpiinc.com. I put together some helpful resources for everyone. I know this was like a ton of information in a short period of time, but I hope you found it helpful in some way. Again, this was part one of the three-part series called Best Practices. We hope you'll join us for the next couple of parts in our series. The next one is Best Practices for the Front Desk. Thank you all for joining me today. I hope, again, that this was helpful in some way for you. I look forward to seeing everyone at our next webinar to cover part two. I'm going to turn this back over to Alexandra Pacheco for questions. Hope everyone has a wonderful day.
Thank you, Caroline. Finally, we do have 2 additional poll questions for you. I am going to place those on your screen right now. Oops, it looks like we're having some trouble with the poll questions. That's all right. Let's move on to our questions. We do have a few questions. The first one is, I look for key things in resumes to try and set interviews for the people I feel would be the most valuable team members to hire. What do you recommend we reviewing when reviewing this as top most key items?
Great question. I think references are very important. I always check references they list for prior employers and friends. Many times you can get a better picture of the individual's personality, work ethic, if they're team players, and more from these checks. I recommend that you always, always, always check references prior to hiring someone.
The next question is, we don't currently use a system that allows us to survey our patients about their experience. What would you recommend we utilize?
Unfortunately, I can't endorse any specific system, but what I can mention that you could Google or for vendors or other survey providers that offer patient satisfaction surveys. Please keep in mind though that you want any survey vendor you choose, if outside of your medical software platform, to be Hipaa compliant. This is super important. I know that there are many survey vendors such as like SurveyMonkey or some online appointment scheduling tools like ZocDoc that may offer these. Just make sure you do your homework and make sure that the service that they provide fits your specific needs.
Thank you, Caroline. And thank you everyone for joining our webinar today. For more information, you can email us at marketing@hpiinc.com or visit us at hpiinc.com. Thank you and have a nice day.